Good evening. My name is Pedro Daniel Rivera, and this is Bio 525, Concepts of Microbiology. This course is facilitated by Professor Sandra Barrera from Grand Canyon University. I am very passionate about the field of microbiology. This is one of my favorite sections. As a laboratorian, it's one of those sections that is almost like being a detective. So there's a lot of work that's involved in identifying pathogens when we receive samples from providers, but it's a very satisfying work once you determine what the organism is. So today we're going to be talking about Chlamydia trachomatis, and that'll be the topic of our lesson, and its effect as the effects that it has worldwide, causing disease specifically to the eye, but we'll also talk about other diseases associated with it. So let us talk about our objective, and I apologize if the slide is not displaying everything like it should. I'm having some technical difficulties, but we will proceed with this and just make the best out of it. So the objectives today that we'll be covering this evening, again, will be regarding Chlamydia trachomatis and its role in causing disease in the eyes, and in times it could also cause blindness in newborns. And we will cover the diseases associated with Chlamydia trachomatis, how and when this organism was first discovered, the taxonomy, the structure, pathogenesis, epidemiology, treatment, prevention, and then we will conclude the presentation. So let us begin with a description of the eye disease associated with this organism. Okay. As you can see, this Chlamydia trachomatis can be very devastating with young children and with many people around the world as an STD, but also just think about this, when a female is pregnant and they have an infection with this STD, once they give birth, they could pass it on to their newborn. It infects their eyes, and if it's not treated quickly, it can lead to blindness. A lot of regions around the world that don't have the medical care that we have, as we will be discussing, it ultimately leads to blindness, and it's unfortunate. So let us talk a little bit about this. So trachoma is caused by the bacterium Chlamydia trachomatis. It is the leading infectious causing blindness. Trachoma is a public health problem in 51 countries, with an estimated 232 million people at risk blinding with this disease. Chlamydia is considered to be the most common sexually transmitted bacterial disease in the world. Albinism states that 4 million new infections occur in the United States annually. In fact, having the pleasure to work in the military laboratory, as already discussed, this sexually transmitted disease is one of the most common STD tests we perform. A study conducted by the CDC placed chlamydia STD infections as the second most prevalent in current population. In most cases, chlamydial conjunctivitis has been found to be concurrent with genital infections. Pregnant females infected with the bacterium are able to infect the eyes of their newborn with Chlamydia trachomatis during the delivery of the newborn. Of course, this is of concern for the newborn due to the possible implications if not acted upon with antibiotics to kill the infection. Untreated infections can lead to blindness, as we already discussed. Thus, it is of utmost importance to treat both the pregnant female and newborn. Symptoms associated with Chlamydia trachomatis eye infections include conjunctival hyperemia, mucopurulent discharge, as seen in the picture. In Chlamydia trachomatis, eye infections include, apologize for that, and lymphoid follicle formation. The disease associated with the newborn eye infection is also known as ophthalmia neoform. and usually occurs within 5 to 12 days of birth, though it can develop at any time until the child reaches 1 month of age. This condition can cause swelling in both of the eyes with mucopurulent drainage, as seen in the image. Treatment of the newborn may include prophylaxis with silver nitrate or an antimicrobial ointment. Additionally, ophthalmia neonatal can be treated with the erythromycin or ethylsulfonate. The success rate is about 80% using either of the options. Second course of treatment, though, may be necessary to ensure the infection completely goes away. Furthermore, topical treatment should be avoided, as it has been proven to be ineffective under these circumstances. It is also believed that infections with chlamydia trachomatis has been involved in preterm birth due to premature rupture of membrane. Additionally, women I apologize, but women who are sexually active and can transmit the disease during pregnancy are at risk for ectopic pregnancy and can lead to adverse pregnancy outcomes to include low birth weight in newborns. So I apologize for that, but it's just I'm just merely trying to state that when females that have this disease, they could have those complications that were as well. So it's not just spreading of the disease to the eyes, but the baby can also be premature and have other complications that could be detrimental to his survival. Therefore, it is vital to ensure that pregnant females receive treatment if suspected to be infected with Chlamydia trachomatis. The CDC recommends erythromycin base or amoxicillin for the treatment of infection in pregnant women, as doxycycline and ofloxacin are contraindicated during pregnancy. So we have to be careful with certain drugs, as they could actually be detrimental to the female. So again, erythromycin or amoxicillin seem to be the best course of actions as far as recommendations from the CDC. Okay, let's move on. All right, so chlamydia infections can manifest in the eyes and cause major problems, as we already has talked about. If not treated, again, it could lead to blindness, as already stated. It is important to note that different subtypes of Chlamydia trachomatis can infect the eyes. In developed countries, it has been noted that inclusion conjunctivitis is typically the most common cause of infection, while in impoverished regions, trachoma is more prevalent. Trachoma is a chronic ocular infection leading to scarring of the eyelids. The scarring can cause abnormal positioning of the eyelashes, scratching, and damaging the bulbar conjunctiva. So let us look at the image to the right and kind of go and discuss this problem. So again, trachoma is mostly seen in those impoverished regions where medical care is not not available as well as here in the United States. But when Chlamydia trachomatis infects the eyelid can actually scratch the eye and then lead to even more complications, which lead to blindness or visual loss or blindness, at worst case scenario. So this is a very serious issue that needs to be taken care of. One thing to note, we've been talking about the neonates and how they could acquire this disease, but it's not strictly just for neonates. Adults can also get this in the eye. So there, complications can also be passed on to adults. It's not only for neonates. So it's basically the way that this disease is transmitted is coming into contact with those fluids that contain the Chlamydia trachoma. And so if it's close to the eye or whatnot, as in when the newborn is coming out of the pregnant female, then obviously they're going to get it into their eye and have that infection. Okay, so Chlamydia trachomatis was discovered by Ludwig Hasselbusch-Strader and Stanislaus von Prowazik. Apologize for butchering those names, but And these two gentlemen, back in 1907, they discovered Chlamydia trachomatis. The discovery was made possible by scrapings that they collected from trachoma patients. And these two scientists named the unusual inclusion bodies that they found based on what they appeared to them. And when they looked at it under the microscope, it looked like it was draped around the cell's nucleus. So they called it chlamydozoa, which is derived from a Greek word named cloak. So it looks like it was cloaking the nucleus. So that's where the name kind of came about. Now let us look at the taxonomy of Chlamydia trachomatis. All right, so chlamydia comes from the order Chlamydiales. The family is Chlamydiaceae, and the genus is Chlamydia, species is Trachomatis. So Chlamydia trachomatis is what we're concentrating on today. And let us look further on how we could break this down. So again, chlamydia is an obligate intracellular organism. We will discuss the structure a little bit further in a few of the other slides that we're going to encounter. But let us talk about the cervores here at the bottom. So A and B, cervores A and B, is what causes the infections that we see in the eyes in developing countries. Cervore C and K is mainly associated with pelvic inflammatory disease, neonatal pneumonia, and neonatal conjunctivitis. And cervore L1 and L3 is typically associated with general ulcers that can result from buboes formation. Okay, so let us talk about the structure of this organism. So again, it is an obligate intercellular gram-negative bacterium, as seen in the picture. Now, what I want you to focus on is not clear in this picture so much, but if you look closely, there are some, you can see right over here in this cell where these are the Chlamydia trachomatis, but you can see how they are inside intracellularly, so they make their way over here. That's the telltale sign that it is Chlamydia trachomatis. It could also look like, over here, it looks like a diplococci, which is another very common, gonorrhea is very common. In fact, they'll test for gonorrhea and Chlamydia trachomatis at the same time, because sometimes you could have co-infections, but also it's just to differentiate, those two. So this gram stains are only a helpful aid. It's not a diagnostic measure. It's just to help us in the laboratory to determine what course of action we're going to take next. Typically, tests that are involved with chlamydia and gonorrhea go into either culture or PCR testing, which is DNA testing. Okay, so let us talk about the structure. So again, it's an obligate intracellular gram-negative bacterium able to infect ocular and genital tissue, as we have discussed. Due to the fact that this is an obligate intracellular organism, the pathogen is able to persist in the host after an immune response. This means that chronic disease can manifest, causing damage to tissues, resistance to apoptosis, and affecting host ability to clear other STI infections. So it could cause many problems, as we can see. All right, so let us discuss a little bit about the pathogenesis of Chlamydia trachomatis. So again, they target the cell nucleus, and then they form those reticular bodies. They continue on with their to replicate via binary fission, those reticular bodies, and they progress to multiply, and ultimately they release their elementary bodies and continue the infectious process. And during that circle of their life cycle. So Chlamydia trachomatis has a single chromosome that codes for 875 genes and multiple copies of endogenous plasmids. Chlamydia trachomatis consists of reticular bodies, as we see on the picture, and resistant metabolic inert elementary bodies that function as infected forms. Chlamydia trachomatis completes its life cycle within the conjunctival epithelial cells. The infected host cells are characterized by the presence of chlamydial inclusions in the perinuclear region. So again, that's one of the ways that we would be able to determine if we're dealing with Chlamydia trachomatis, if we see those intracellular bodies in the cells. Okay, so epidemiology. So as already indicated in this lesson, urine genital infections with Chlamydia trachomatis is one of the most common bacterial sexually transmitted diseases worldwide. This is especially true in developing nations where medical care is hard to find. The WHO sees this as a worldwide public health problem, along with infections associated with Neisseria gonorrhea and HIV. Impoverished regions tend to have more issues due to a lack of medical care. Trachoma-related infections are the primary source of infection, blindness worldwide, mostly affecting poor regions in Asia and Africa. So as you see in this slide right here, all these red regions are common, areas that are endemic for blindness, trachoma. So they're hardest hit with trachoma-related blindness. And then the pinkish regions countries are under surveillance, and then and then everybody else is just not as common. But again, those red covered areas are the ones that are highly affected by the trachoma blindness. Okay, so prevention and treatment of this disease. Pretty gnarly picture right there, depiction of somebody who has really bad infection with this disease. But and with any STD, the only way that you could be sure not to get it or spread it is abstaining from sex, and the use of condoms highly recommended. And receiving medical care early is imperative. And we will discuss a little bit about the different testing methods that you could use to kind of diagnose this disease. So again, the only way to not get the disease is to abstain. The use of condoms highly encouraged, and especially if those folks are engaged with multiple partners. If individuals think they have been infected, it is vital to get medical assistance and avoid having sex. The CDC states that chlamydia can be easily cured with antibiotics. CDC also recommends that persons with chlamydia should abstain from sexual activity for 7 days after a single dose of antibiotics or until completion of a 7-day course of antibiotics. Screening and diagnosis of chlamydia can be performed via urine test or swab. Urine samples are analyzed in the laboratory using various methodologies to include PCR DNA testing. Swab testing is performed by a doctor collecting discharge from the cervix and then submitting to the lab for testing. Sometimes that could be culture again, or it could be PCR testing. Finally, for men, a doctor may use a slim swab that is inserted into the penis to get a sample from the urethra. Doctors may also swab the anus if indicated. So for males, this could be a very painful process, to collect a good sample. Okay, so in conclusion, Chlamydia trachomatis, as we have discussed, is a public health concern worldwide. It's imperative that all individuals follow safe sexual practices and receive medical attention quickly when indicated. Pregnant women should ensure to protect their fetus from this disease by heeding the warnings we have covered from the CDC, Mayo Clinic, and the WHO. The WHO being the World Health Organization. And again, just making sure that that good, safe sex practices are followed. Again, in other regions of the world, you know, getting a good medical attention might be hard to get. And so, or laboratory tests to confirm that or to diagnose might not be available. So in those certain regions you know, it is a problem, and the World Health Organization is trying to do a good job in trying to mitigate these problems. But again, chlamydia trachomatis is a public health concern. Individuals should follow safe sexual practices, receive medical attention quickly when indicated. Pregnant women should ensure to protect their fetuses by getting screened. That's imperative. That way they get medications as soon as they can, in order to see if they could, you know, stop the infection before the baby is born. And everybody should follow the recommendations and warnings from the CDC, Mayo Clinic, and the World Health Organization, to ensure that everything is that everybody's being safe. Okay, the next few slides are my resources that I use, but I want to conclude by saying thank you for taking the time to view my presentation. I hope you enjoyed it, and I wish you a good night. Here are my references. Apologize for that technical problem. See if we could go back to the references. Okay. So I apologize for that, but the references didn't, I couldn't go on to the next picture. So I'm going to stop sharing right now. But again, thank you for everything, and thank you for taking your time to look at my presentation. Have a good night.